Right on the heels of National Nurses Week, New York Presbyterian Hospital has announced its plans to lay off about 2% of its workforce, which equates to about 1,000 employees. Don't know yet exactly what the breakdown of those employees is going to be, but we do know that it includes nurse practitioners and nurses. They are allegedly laying off all of their nurse practitioners except the ones that were hired before 2010, and have allegedly already laid off 50 RNs from the Columbia campus, from what I'm told. But are they not still building a new cancer center and like enlarging another hospital? But they're citing financial difficulties.
What up, Nurse Gang? What up, TikTok? So today on Nurses in the News, Kaiser Permanente, the healthcare giant, is laying off nurses in California. Yes, Kaiser sent out 42 layoff notices to nurses working in outpatient clinics, mainly GI, OB, and mental health at San Rafael and Petaluma. They are giving the nurses 60 days. They're saying that they have about 400 open positions across the health system in California, and the nurses have time to transition into another job within their healthcare system if they want to stay with Kaiser Permanente. They said they have to make these cuts. They just do not have the funding. What are your thoughts? Let's talk about it.
Quick question for those of you who support the government's current immigration policies and the one big beautiful bill, Medicaid cuts. Did you know that 25% of all nursing care facilities employees are immigrants? And did you also know that these Medicaid cuts that are going to take place are actually going to cut into the amount of money that nursing homes can receive from Medicaid? Good job, guys. You most likely screwed somebody over in your family, and maybe even yourselves. Because here's the reality. Half of Americans don't even have $1,000 saved to pay for an emergency room visit. How are you going to pay for a nursing home?
Hey everyone, quick update you need to hear. San Diego-based Sharp Healthcare just announced that they're laying off 315 employees, which is about 1.5% of their workforce. This includes senior executives and roles in medical information and marketing. So what's driving these cuts? According to Sharp, the rising cost of healthcare is outpacing revenue. They are also facing state-mandated seismic upgrades and poor reimbursement rates from payers.
Oh, if they take Medicaid, oh, if they cut SNAP, those people who don't want to work have to work. No, I don't think you're looking at the deeper picture. Nurses, doctors, CNAs, LPNs, all of them going to lose their jobs too. How, you may say? Well, if they cut all those billions of dollars in Medicaid, most of the people in hospital depend on Medicaid. Most of the people in nursing homes depend on Medicaid, which where RNs and doctors and nurses work. So if all of them die, who's going to fund the hospitals and the nursing homes?
Hi guys, welcome back to the channel. Thank you so much for being here and thank you for your support. Today's video we need to talk about something serious. Nurses across the US are getting laid off and it's happening fast. Why? Because of massive Medicaid and Medicare cuts made by the government, and it's starting to affect real people, real hospitals and real life. Let's break it down. But before, let me play a few clips on the same issue and I'll be back with my commentary. All credit goes to the original creators of each and every video you see here.
So that means that everybody else lose their jobs too. So I don't think y'all really thinking this out clearly. So all them Senates who got RN doctors, RN daughters and all that, when they start losing their job and then, oh my gosh, God forbid they lose their job and they can't take care of their kid, they can't pay their house mortgage, what will they ever do? What will they do? Oh no. When their grandma die. Oh no. When their third cousin die and then they got to go to the funeral and they say, what did Mary Lou die from? And then they say, because Mary Lou was on Medicaid and you guys cut the Medicaid and Mary Lou died, and then what? Oh, my bad.
So bottom line, they say they can't keep up with the economics. Here's what else is changing. Some staff will see reduced hours and others will be moved into adjusted roles. Sharp says the majority of cuts are in non-clinical areas, so direct patient care won't take much of a hit. Leadership is also fearing the squeeze. Senior execs are taking a 15% pay cut, and the CEO, Chris Howard, is trimming another 10% off of his own salary. So now Sharp is offering severance, extended health care, and career transition support for those impacted, which is better than what some other systems that I've reported have offered. But still, this is a signal that no health system is immune, especially if you're in a non-clinical or even in an administrative role. If you're a nurse or allied health professional thinking your job is secure just because you're not at the bedside, this is your warning shot. So let me know, definitely in the comments, are you seeing cuts at your facility too? And if you're in a non-clinical role, are you making moves to protect your career?
In early 2025, a bill called the One Big Beautiful Bill was passed. Sounds nice, right? But what it actually did was cut billions of dollars from healthcare programs like Medicaid and Medicare. And now we are seeing the results. Hospitals don't have enough funding and they are laying off nurses, the same people we called heroes during the pandemic. Across the country, hospitals in rural areas and small towns are affected the most. These places depend heavily on Medicaid funding. Without that money, many hospitals are shutting down departments, cancelling services, and yes, firing staffs. That often means that nurses are the first ones to go. Imagine working long shifts, caring for patients, and then being told you are no longer needed, not because of poor performance, but because of budget cuts from the government. What makes it worse is that the US already had a nursing shortage. We were told that more nurses were needed, more training programs were needed. Now those same programs are losing funding too. The National Institute for Nursing Research is being shut down. Educational grants are being cancelled. So not only are the current nurses losing their jobs, but future nurses may not even get trained. Let's be honest, this is not just about jobs. When the nurses are laid off, patients suffer too. Longer waiting times, fewer people to check in on patients, more stress on the nurses who are still there. It's a domino effect, and it is dangerous. Many nurses are speaking out. On social media, in interviews, they are saying they feel abandoned. They worked through a pandemic, they were praised, clapped for, and now they are being laid off without any warning. And you know what? People are mad, especially in states that voted for the leaders who promised better healthcare and less government waste. Well, this is the result, cutting services that actually help people. So the next time a politician says we need to cut spending, ask them at what cost? Because if nurses are losing their jobs and hospitals are shutting down, then maybe those cuts are not as smart as they sound. Let me know in the comment section what do you think about this. Are nurses in your areas being affected too? Thanks for watching. I'll see you in the next video.